Hi, this is Dr. Thomas Moshiri with Arizona Pain. I'm an interventional pain and spine physician, and I'm here to answer some of the commonly asked questions about some of the procedures that we do and some of the services that we offer. So who is a good candidate for spinal cord stimulation therapy? Really, any patient that has had either pain in the neck, up in the shoulders, thoracic area, or even in the lower extremity is a great candidate for spinal cord stimulator therapy. We typically see this in patients that have either diabetic neuropathy or just neuropathy of an unknown reason, whether if it's due to trauma or some other reason, autoimmune disease, things like that, or patients that have had prior surgery in their spine and they still continue to have pain. And those patients are ideal candidates for spinal cord stimulation therapy. What are the benefits of spinal cord stimulation therapy compared to other treatments? Well, what's interesting about spinal cord stimulation therapy is that there's really nothing else like it in the market. And there's really no other treatment that you can try before you commit to it. Since the majority of patients that benefit from spinal cord stimulation therapy are patients that have had prior surgery and still continue to have pain to this day, those patients are ideal candidates. They come in and we can do what's called a trial to see if it actually gives them the amount of relief that we hope that it does. And once the trial is done, then they can decide on their own if this is something that they want to commit to or not. There aren't a lot of procedures in medicine that you can try before you commit to, and this is one of those amazing procedures that you can try. We have an almost 90% success rate with our patients who undergo this treatment. So how is a spinal cord stimulator therapy performed, and is it minimally invasive? Let me start off by saying that spinal cord stimulation therapy has two phases to it. The first is a trial phase, and then the second is an implantation phase. The trial phase is very simple. Essentially, a patient comes in and, much like an epidural steroid injection, we essentially clean up the skin, place a needle through the skin into the epidural space, and put a lead into that epidural space, which then is percutaneous, which means it comes out through the skin. And the patient keeps that lead, which connects to a battery, and they keep that for about 7 days. And during that time period, there is essentially a trial period during which they determine if this is something that's going to work for them. In and of itself, it's a very minimally invasive procedure. They essentially there's no incision, there's no scarring, and you essentially just have a small lead that's sticking out of your skin. Let's talk about the implantation phase. Implantation of a spinal cord stimulator system is slightly more involved than a trial. How it works is essentially we put two leads into the epidural space, much like we did with the trial phase. However, the two leads are then tunneled under the skin and connected to an IPG unit, which is essentially a battery and a computer all in one, that is also implanted underneath the skin. Very small incisions that are made, and patients go home same day. The procedure takes about an hour and a half, and patients start to feel significant relief in about 2 to 3 days. Minimal pain involved with the procedure, and patients do amazing. What are the potential risks and side effects of spinal cord stimulator therapy and treatment? Well, the risks are pretty minimal, just like anything else that you would do: infection, bleeding, nerve damage. Those are the main things. We minimize the risk of infection by using sterile technique, working in the operating room in a sterile environment, and obviously sterilizing the patient's skin before we do anything. So that really minimizes risk of infection. We also treat patients prophylactically with antibiotics when we do an implantation. So again, to further minimize risk of infection. Now let's talk about bleeding and nerve damage. Those risks are significantly minimized because we're using live fluoroscopy, live x-ray, to see exactly where we're going. And this is really more for the trial than anything else. But for the implantation, we're still using live fluoroscopy, but we're also directly visualizing what we're doing around the spine as we're working. And so we significantly minimize risk of bleeding and nerve damage because we have direct eyes on the area that we're working on. So overall, risk is very minimal. Patients tend to do extremely well, and they go home the same day. So really a very, very safe procedure, and we've had really, honestly, in our practice, we've had less than 1% of complication rate for any of those kind of complications that I just mentioned. So how does spinal cord stimulator therapy improve quality of life. This is one of those revolutionary therapies that I feel like have really made a significant change in what we can do for our patients. The patients that qualify for this procedure and also then benefit from the trial and the implantation have really greater than 90% improvement in their quality of life. And we have had patients that have had significant change in their quality of life and in their ability to be functional and do the things that they enjoy that they never thought was possible. So if you have not heard of this therapy, please speak with your provider and see if you're a good candidate. Are there any lifestyle changes or follow-up care needed post spinal cord stimulator therapy? With respect to the trial phase of spinal cord stimulation therapy, there's really no lifestyle change that's needed. As a matter of fact, we want patients to be as active as they can be to see if the therapy is going to help them and if it's going to work for them. For the implantation phase, typically there is some activity restriction once we actually implant the spinal cord stimulator. We typically have patients refrain from lifting heavy objects for about a month. And we also ask them to refrain from doing, vigorous activity that would create problems with wound closure and things like that. But outside of that, there's really no limitations. And most of the time, patients have so much relief and have such recovery from their whatever is the reason that brought them in that they really can't wait to get back to having a normal life and being as active as they can be. Let me tell you about a testimonial of someone who's very dear to me, who actually has undergone spinal cord stimulator therapy. So my father-in-law is someone who suffered for years from neuropathy in his hands and feet, and he was not able to drive. He was not able to ambulate around very well. He had difficulty with picking up the grandkids, my kids. So I recommended that he undergo spinal cord stimulation therapy, and he underwent the trial and had a successful trial, and then we moved forward with an implantation. And let me tell you, he has had a complete alteration of his life. Not only is he able to get around, he's able to drive, he's able to walk without pain, and he was somebody who was taking significant amount of pain medication, narcotic pain medication, and he was able to come off of all of them entirely. And so he now is somebody who's active, who can get around and do things, not on pain medication. He can engage with the grandkids. And so when I tell you that this therapy is life-changing, it is completely life-changing.